was significant was that Callan had the breathing tube in place through the vocal cords without any sedation. So without sedation, would having a breathing tube in that place cause pain?
Yes. No one would be able to tolerate it.
And so Callan was able to tolerate it without any sedation.
Yes.
Would that indicate he wasn't feeling that pain at that time?
Yes, exactly.
And you mentioned that you would address the patient by name and talk to them. Was there any reaction from Callan when you did that?
No, there was not.
And then you mentioned you would rub maybe something along the foot. Was there any reaction?
No, there was not.
And did you do what you described in pinching the fingernail or pinching somewhere on Callan to see if he responded?
Yes.
And did he respond?
No, he did not.
And what did these interactions and tests on Callan tell you about his condition?
This told me that he was unresponsive. He was unresponsive to both things that would cause discomfort and things that would cause pain.
Did you also do anything in terms of looking at his pupils and any tests on his eyes?
Yes. So after all the other things, that we look at the pupils, and so one of the things is we have it's a reflex response. If a light is shown in an eye, the pupil constricts. And what I noted about Callan was that his pupils stayed widely open and did not constrict.
And when someone's pupils stay open and wide when you shine a light in them, what does that indicate medically? Well,
the eyes are a direct extension of the brain, so that's why we focus a lot on them as an area of investigation. And the lack of a response to light indicates that there's some abnormality to that, and in this case, it was a brain injury. There's medications that can keep your eyes open if you've ever had an eye exam, but that was not the case with Callan.
And just to be clear, when you're talking about brain injury, we're not talking about some type of trauma that was inflicted on the brain. You're talking about the lack of oxygen and blood flow causing an injury to the brain, correct?
That's exactly correct, yes.
At that point in time, did you work with another doctor to do more in-depth testing regarding his neurological status?
Yes. So at Children's, we have multiple teams that come together for a patient, for many patients. But for Callan, the neurology team was there from the beginning. And when in a case like this, when we see no response in an unresponsive patient, we start to get our neurology team, and one of the things we start to do is brain death testing to see if they could be what we call brain dead, meaning that the brain itself is not functioning, and that even though their heart is still beating.
How is it that someone's heart can be beating if their brain is dead?
It's a really good question. So there's actually two parts to the nervous system. The one is the part that we see the most in people when they react to us and they speak and they do things. The other one is the autonomic or automatic system. And the automatic system is largely in charge of the things like the heart if the heart has not been injured. And so it was sort of continuing on.
And does that give you any indication, the fact that the heart was still continuing on, about where the injuries were in the brain?
Yes, it does actually. Yeah,
Where would that be?
Yeah, so the large part of the brain that we sort of think of as when we see the pictures of the brain, that's the cerebellum, and that's the biggest thing in humans that is most developed, and that's in charge of our consciousness, our reaction to things, whereas the brain stem, which is another part, and that's really part of the autonomic system, and that's the same in almost all vertebrates and mammals, and it's much more automatic, and so it tells me that it seemed the cerebellum, which is that part that makes us sort of the human side of what we do, that's much more sensitive to a lack of oxygen, to an anoxic injury. And it told me that was really where that injury was in that part of the brain, much less so in the brain stem itself.
So would it be fair to say that the brain stem itself that controls those automatic responses was still functioning somewhat, but the part of the brain that made Callan was not functioning?
That's exactly correct, yeah.
And can you describe for us the brain death testing?
Sure. So the brain death testing at Boston Children's it's a very strict testing that includes some of the things that I just mentioned. But we work with our there's a checklist that we work on with our neurologic colleagues. And we sort of go through each of what we would expect for responses from someone, and we actually then work through different of the nerve sets that we would expect them to respond to. We have it set up so that there's an ICU physician is there, and then a neurologist is there, and the neurologist and the neurology team, they're the ones who perform the brain death testing. And then the test is then repeated again 24 hours later, just to make sure that there's no piece of that is different or incongruous with a diagnosis of brain death.
And while the neurologist is doing this testing, are you there present, watching the testing and seeing the results as it happens?
Absolutely, yeah. So we're sort of committed to being there for the whole time. And the brain death testing itself goes through some really basic things. Again, as I described earlier, the things that would be painful and do they pull away or not. The eyes, looking at the reflexes of the eyes. There's also other reflexes too. Things like if you stroke the cornea, which is the front of the eye, people blink, and that's so the blink reflex, cough, gag. There's also a reflex where they actually put cold water into an ear, and that gives people a disequilibrium. And so those are all the things that we think about. And then also too, there's some breathing components to that as well.
Is one of those breathing components an apnea test?
Yes, it is. Yeah.
And what is an apnea test?
So apnea is a word that just describes describes a lack of breathing.
And how do you test that?
So in a patient such as Callan, what we do, and in any patient when we're doing brain death testing, we actually disconnect them from the ventilator. And the reason that we do that is we want to see if that autonomic system in the brain will start to react as the carbon dioxide starts to increase. So our body makes carbon dioxide all the time, and the way we get rid of it is by exhaling. And where we breathe in fresh oxygen, and then we breathe out CO2. And what we do is we disconnect from the ventilator to see if, knowing that their carbon dioxide will start to rise, and the normal response